Hi, my name is Chrissy Vinton. This is Hershey. I'm going to be showing you how to do your horse's horse health check or vital signs. It's really good to know how to do vital signs in case your vet might not be able to get there as soon as you can. You can take vital signs so that he knows exactly what's going on when he gets there. It's also good to know your horse's normal vital signs, so if something does happen, you kind of have the range to where your horse needs to be. That'll also help the vet or yourself figure out if something's wrong. You need to also know the ranges that it could fall in for each vital sign. I'll kind of explain those as I do them, so you know which is the range for each vital signs. But it's really good to know how to do vital signs because your horse may be colicking, you might just be checking him because you're concerned. It's just really good to know your vital signs, so I'll show you how to do them. So the first vital sign that you really need to look at is just your horse's overall health and condition. So Hershey here is normally happy, he's normally very curious, he loves attention. So if the first indication that something might be wrong for him is if he's standing in the back of his stall, if he doesn't come to you when you first want him, if he's pinning his ears, grinding his teeth, if he just doesn't look happy to you, because usually he's a pretty happy horse. But another thing is just their overall conditions, like is their skin healthy, are they a healthy weight, do they look normally healthy compared to a non-healthy looking horse that you might find. So overall appearance, something else that you can look for is if they're weight bearing. If they're not weight bearing, that's probably a good indication that something's not right, something hurts, they're in pain. Also, if they're uncomfortable. So he's usually not a stall walker, so say I come in one morning and he's consistently walking in his stall, or you can tell that he's been walking in his stall. That could be an indication that he's uncomfortable, that something might be painful or is not right. Also his attitude, like I said before. He's happy and curious. If he's not happy, there's probably something wrong, because 100% of the time he is ears forward wanting attention. Another thing is if you go to a stall and he hasn't been drinking water. So if his buckets are still full from 4 hours before when you filled him, that probably means he isn't drinking water, and you should probably be taking vital signs or trying something else to get water into him. Also food, he normally cleans up his food pretty easily. If you come in one day and there's hay or there's still grain all over his stall, that's a big concern because that means something's not right. Also, he usually is a pretty clean stall, so if you get there in the morning and the poop is everywhere and it's just a dirty stall in general, that could be another really good indication that he's uncomfortable and not happy. So the first vital sign we're going to look at today is mucous membranes. Mucous membranes are the lining of the body openings. We mainly focus on the conjunctiva, which is the eyelids, or his gums, which are in his mouth. So we want our mucous membranes to be a pink, moist color. You don't want them to be dry or any other random color. If you do have other colors, some examples of those would be like a fiery red, which might indicate a fever or infection. If you have yellow, it might indicate like a liver problem. Pale color is more like an anemia or shock. Dry means that they haven't been drinking a lot of water, that they're dehydrated. And a bluish purple could be the lack of oxygen, which those are all concerning problems that you might have to have a vet get involved. So how to look at your mucous membranes is you don't want to stand in front of them, so you're going to kind of just peel back their lip like this and look at the color. So his are nice and pink and they're very, very moist. They're not tacky or anything like that. So he's got really nice mucous membranes. So another thing that kind of goes along with your mucous membranes is your capillary refill time. Capillary refill time could also help you with whether they've been drinking water or if they have good oxygen and blood flow to the area. So you kind of do the same thing with your capillary refill, and it should be between 1 to 2 seconds back to normal. So you kind of do it again. You don't want to stand in front of them. You're going to open up their mouth again. I kind of keep my thumb out so that I can press for 1 to 2 seconds, and then I'm going to release and watch it go back to normal. And his went back to normal within 1.5 seconds. So he's got a really good blood flow back. He's not dehydrated at all. So that's how you do your capillary refill time. So the next vital sign I'm going to talk about is your pulse. Your pulse can be taken anywhere that there's a large artery. The best that work that we like is under his jaw, which is called your maxillary artery, or behind his knee, which is called your radial. It doesn't really matter which one you do. The maxillary is a little bit more prominent, so it's going to be easier to find. You're looking for about 32 to 44 beats per minute. So that's going to be a reflection of your heart rate. So if you can't find your heart rate, you can take a pulse or vice versa. It kind of just depends what you're good at, but you should take both just to compare. And it's good to compare. But when you do it, you're going to time for 10 seconds and then times that number by 6. So to take it, we're going to unclip this piece of his halter so that I can get my hand underneath his jaw comfortably. So I'm going to put my fingers like this, and I'm not going to press on the artery, but I'm going to kind of put my fingers around the artery. And I'm just going to feel for it. When I find it, I'll tell my timer, oh. So now that I've found it, I'm going to tell my timer to time for 10 seconds and start now. Oh.
Time.
Okay, I got 7 seconds, so I'm going to go ahead and clip this back on so he's got his halter on. And 6 times 7 is 42, so his is within the normal 32 to 44 beats per minute. That's how you take your pulse, and it would be the same for your knee. You would do the same thing and times by the same number by how many beats you get. So the next vital sign that I'm going to show you is your heart rate. Like I said before, your heart rate and your pulse should be the same. They should not be off from each other, especially if you take them within the same couple minutes. If the horse hasn't changed, exercise, if it hasn't been stressed out, it should be the same. So when you take your heart rate, it should be like your pulse, between 32 and 44 beats per minute. And you take it along their heart girth, kind of under their belly, kind of right here behind their elbow. You usually find it right here because there's not a big lining. So when you do it, you're going to do 10 seconds by 6, however many beats times 6. So to find it, I'm going to put the stethoscope on. And then I'm just kind of put my fingers around it and just kind of gently push. Tell them I'm there. And then I'm just going to listen. And when I'm ready, I'll tell my timer to start timing for 10 seconds. Go ahead and start now.
Time.
Okay, I got 7 again, so that means his heart rate is 42, which was the same as his pulse rate, which is good. And that's how you take his heart rate. So some things that could change his heart rate or his pulse. If he's stressed out, if he doesn't feel good, that could increase his heart rate and his pulse. Also, if he's been exercising, his heart rate's probably going to be elevated. So you need to let them cool out. If you're just going to take his normal vital signs, he needs to cool out and be comfortable so that he can have a normal heart rate. So the next vital sign that I'm going to show you today is respiration rate. Your respiration rate should be between 8 to 16 breaths per minute. Another thing that could alter your respiration rate is if they just got done exercising or if they've been stressed out for some reason. So you have to kind of watch that and know if that's going to affect your beats per minute or your respiration rate. This should be lower than your pulse. If it's not lower than your pulse and your heart rate, you could have a inverted respiration rate, which is not good, and that usually indicates that you need to have a vet out immediately due to him breathing faster than his heart is beating. So you never want to watch their nostrils, because if you kind of watch, they kind of wiggle, they kind of are misleading into when he's actually taking a breath. So we're going to watch his belly about right here on his flank, and watch it go in and out. Sometimes if it helps, you can put your hand here and feel it go up and down. I do better just standing and watching. So we're gonna do it for 10 seconds again, and we'll times it by 6 to see what his respiration rate is. So I'm gonna go ahead and watch it, kind of get an idea, and then I will tell my timer to start timing for 10 seconds. Oh. Go ahead and start. Oh.
Time.
So I got 2 breaths in that, so that means he has a respiration rate of about 12, which is pretty normal, and he hasn't been doing anything stressful, he hasn't been exercising, so that's going to be his normal respiration rate. So the next vital sign that I'm going to show you is a skin pinch. A skin pinch is done on their neck, above their shoulder, about right here in the line where there's a lot of skin to where you can grab. We do a skin pinch to mainly test for hydration. So when you do your skin pinch, you're just gonna kind of grab his skin with your pointer finger and your thumb, and you're gonna pull up like this, and you're just gonna hold it for 1 to 2 seconds and then let go. And just like his did, it should go down to a normal flat within 1 to 2 seconds. If his skin were to stay out and tinted like this, as we call it, that can mean that he's not hydrated, and that's a bad thing. You also have to really know what your horse's age is. Since he's a younger horse, his skin has got a lot of elasticity, but if, for say, I was doing this on an older horse, maybe in his 20s or late teens, his skin doesn't have the correct elasticity, so it's going to tent a little longer, but as long as it goes flat within a few seconds, then it should be fine. So the next vital sign that I'm going to show you is one of the most important, I think, and it is their gut sounds. We listen to their gut sounds because it kind of gives us an indication what's going on inside of them, kind of like the heart rate is. So when we listen, we're going to listen. You want consistent movement. You want the gurgling, the swooshing, like the waterfall noises. You want that all the time. If you don't have that and there's no noises, that could mean that they're possibly colicking, that there's something wrong going on before you get to their guts. So you also, if they're overactive, so if there's a lot of movement, there's really loud movement, and they kind of don't have moments of slight silence, then they call that hypermodal, which is also a big problem, and you should probably have your vet involved for no sounds or hypermodal sounds. So something that's really important with gut sounds is your safety. Since you are next to their hind legs, we have a horse now in Western that if he is colicking and you go to touch anywhere on his belly, on either side, he gets very, not aggressive, but he likes to kick out at you, and that could be a major problem when you're trying to listen to his gut sounds and he's trying to kick you. So that's something you always need to remember. So you kind of have to watch that. Hershey's usually pretty good. He isn't going to do any of that today. So we'll be able to take his gut sounds on both sides. So a horse has got 4 quadrants. There's 2 or 1 on each side in the upper, and there's 1 on each side in the lower. When you do your gut sounds, you want to do all 4 quadrants, but for my video, I'm just going to show you how to take them on one side because it's the same on both sides. But when you do have to do your vital signs or your gut sounds, you have to listen to all 4 quadrants to be able to get an accurate analysis of what's going on. When you do listen, for say this upper left quadrant might be normal. It might have normal whooshing waterfall sounds, but then you might get to this lower side and it could be dead quiet. That's very normal that one section is the section that might not be happy and this section might be perfectly fine. So that's something to kind of keep in mind when you're doing it. So when I do my gut sounds, I'm going to either use my ear, and if I do use my ear, I'm going to kind of put my hand up here and my hand on his butt and just kind of tell him I'm there and just slightly lay my head down on him so I can be able to hear into this quadrant. Or you can use a stethoscope. I'd rather use the stethoscope than my ear, so I'm just going to put these on, move them over first. Cool. So I'm going to put my stethoscope on, and I'm going to make sure that he knows that I'm going to be touching him. So I'm just going to kind of pet him, and I'm going to take my stethoscope and kind of just place it in this area here. It kind of depends on the horse where you're going to be able to hear the gut sounds. You're just going to have to play around with it and see if you can find them and where you find them the best at. So right off the bat, he's got really good water fountain swooshing sounds, which is very normal for him. It's actually very good sounding. So I'm kind of just in this section, right in front of the flank on his barrel, upper barrel for this quadrant. It'd be the same for the other side. On the top would be in about the same area as well. So now to do my bottom quadrant, put my stethoscope back on. Again, tell him that I'm going to touch him. Kind of place it underneath here. Keep telling him. Kind of standing off to the side, but still very close. Oh. Oh. He also has really nice gut sounds in this quadrant as well. A lot of gurgling in this quadrant, which is good. And there's lots of movement. There's not too much movement, but there's always movement within his gut, which means that his gut is working really nice. And that he shouldn't have any problems with a colic or anything tonight. Gut sounds change all the time. I could come back in 5 minutes and it could be different. But right now, he's got really good gut sounds on both sides. Again, if you were taking your vital signs and your gut signs, if you thought he was colicking, you would need to take it on all 4 sides. But just for my video, I just showed you how to do it on this side. So the next vital sign, and the last vital sign that I'll be showing you today, is his temperature. You take temperature for a couple different reasons. It kind of gives you an indication on if they are running a fever or if they are normal temperature. And you really need to be taking their temperature. You should be, when you first get a horse, you should take their temperature for about 3 to 4 days to know what their normal temperature is. I've taken his temperature a lot, and I know that his temperature is usually over 100, but nothing over 100.5. But his normal temperature is in the hundreds, which is completely normal for him. So their range usually is between 99.5 and 101.5. If you reach anything over 102, that usually means that he has a fever, and usually a vet should be called out to help you determine what will be the next steps for that. There's 2 different ways to take a temperature. You can use a digital thermometer, which is kind of like the ones that you have in your house. They beep when they're done. Or a mercury thermometer. The mercury thermometer has to be in for 2 minutes, so we have a string and a clip, so we can clip it to his tail so he doesn't suck it in and cause more problems. When you do the mercury, you have to shake it down to under 98 degrees so that it will work. You also have to have petroleum jelly or some kind of jelly to put on it so that it is easy to go in and isn't going to irritate them when it is in there. So we're just going to start with our normal digital thermometer. Put this one in my pocket. I'm going to take the lid off my petroleum jelly, and I'm never going to stick the thermometer in the petroleum jelly. I'm only going to put my finger in here and rub it on the end of it. You don't really need a lot, just enough to cover the tip of it. And then I'm going to set wipe the petroleum jelly off, set my petroleum jelly down. Then I'm going to come back here, and I'm going to stand on this side. Turn my thermometer on, and I'm going to make sure that I'm not going to get behind him when taking it, but I'm going to stand nice and close with my hand on his rump to kind of tell him that I'm going to come in here with something underneath his tail. So I'm just going to kind of tell him that I'm here. I'm just going to slowly run my fingers down with my thumb and move his tail up to this side. I'm just going to take my thermometer, and I'm going to gently and slowly push it in, and I'm going to angle it up a little bit so that it's not in a piece of poop, it's actually reading the rectal wall. So then I'll wait for it to beep, and when I take it out, you can use your tail to kind of wipe it off, to clean it off. And so you can see his is 100.2, but I know that's fairly normal for him as long as it's not over 100.5. So he's got a normal temperature. So now that we've taken our digital, we have our mercury thermometer. So I'm going to shape my mercury thermometer to under 98 degrees. So you just shake it down. And see where we're at. Okay, so now that I'm under 98 degrees, I'm going to I have a little petroleum jelly on my finger, take it and rub it on the end of it. I'm going to wipe it off. Then I'm going to do just like I did with the other one, except for I've got the clip this time. So I'm just going to lay the clip over my hand. But I'm going to tell mine there again. Come in, make sure I'm standing close but not behind him. Lift his tail off to the side. And stick this in just like I did with the digital. Kind of up against it, if he'll let me come in a little further, like that. And then I'm just going to lay his tail down, and I'm going to clip this to his tail so that he can't suck it in. So it's nice and in there, nice and tight, so he can't get it off. So now we're going to wait 2 minutes. So now that it's been 2 minutes, I'm going to go ahead and take out my mercury thermometer. So I'm just going to tell him I'm there again. I'm going to come in, lift his tail slightly to the side, and pull out. I'm going to unclip it from his tail, clean it off. And then I'm going to read it. So I kind of have to find the right angle. So yep, so he's got 100.3, or not 100.3, my bad, 100.3 temp, which is pretty similar to our digital. Usually a digital is a little lower than our mercury, but it's pretty close overall. So that's how you take your mercury temperature. So I've showed you a couple different ways, or a couple different vital signs that you can do on your horse. Remember that you need to have a normal range for your horse, but also know the normal range for all horses in general, because it's really good to know, especially with his temperature. I knew that his temperature is normally higher, so I wasn't in concern when it was over 100 degrees. But it's just good to know how to take your vital signs, especially because it helps the vet. If you already know what their vital signs are, they can go right into treatment or different actions when they do arrive. But you need to remember that their overall condition and health also helps indicate if they're uncomfortable or if they're actually feeling happy. So I hope that these vital signs will help you in the near future when taking your horse's vital signs. So I hope they help.